This is a pretty big departure from just a few weeks ago, Steve.
Yeah, absolutely. And I find these comments coming from the former deputy head of China's equivalent to the CDC. He's now an advisor, senior advisor to the Beijing government on its COVID controls. His comments are not necessarily anything extraordinary, but it's extraordinary that they were printed in state media on the same day, essentially, that the Chinese government made a nationwide shift, a U-turn, if you will, in its COVID-0 strategy. In fact, they're not even using that term, dynamic COVID-0, anymore. Well, at least the Politburo didn't in their readout of their gathering in Beijing. So there's some major policy changes going on that just a week ago, perhaps, the comments from Feng Zijian would be a bit sacrilege because it would be perhaps perceived as being, or would undermine Xi Jinping's signature COVID policy. This is what he said. It's going to be inevitable for most of us to get infected at least once, regardless of how the COVID fighting measures are adjusted. And he predicts probably in this current wave that they're seeing in China, where they're seeing more than 20,000 cases, new cases a day, probably 50 to 60% of the population of China will be infected, and that could go up to 80 to 90%. That is essentially living with the virus, which the rest of the world has already done. So this is a dramatic U-turn in policy and in narrative. Just to have that kind of comment come out in state media, and the China Youth Daily says a lot. Now, it doesn't mean they're not going to do some control measures. Let's also bring up the the National Health Commission's head of expert panel. He's Liang Wannian. He had a presser yesterday. He led it. He says this new optimization is not completely relinquishing control, but a proactive rather than reactive adjustment. We'll have to see going forward just how reactive the people of China will be to this new relaxation.